today's disease is the studies, the medical problem we're discussing is called as Wilson's disease. So what is Wilson's disease? So basically, it is a genetic disorder, as you all can see. It is caused because of genes, and the main problem is with copper, right? And what happens basically, you start building up excessive copper in your body. So we all have copper in our body. We all extract it from different foods, right? And it is a requirement in our body. But what happens over the time that if something goes wrong that we talk about, it gets it does not get excreted in the bile and start accumulating in the body. And when it starts accumulating in the body, it causes problems. Okay? And the main organs that are affected are brain and liver. So you need to remember Wilson's disease, a genetic disorder. It is to do with the copper and the excess copper, right? And gets deposited in the brain and the liver. So you remember all these three are very important. If you remember this, you can always get set up, right? Wilson's, copper, genetic, and brain and liver. Now let's go. So what is the mutation? This is where the mutation happens in Wilson disease protein. It's called ATB7B gene, right? So there's a protein which has to do with the copper, and that gene is ATB7B, right? And what it does, it simply excretes the excessive bile copper in our bile, right? This is what it does. So when it is affected, of course, the copper cannot be excreted, and that will cause its accumulation in the body, right? Simple, right? And this is basically an autosomal recessive, which means what? That you have to have the genes from both the parents to have it. Remember, it's not like autosomal dominant, it's not X-linked, it's simply autosomal recessive, right? So both the parents should have the affected genes so that the kid will have a problem. Okay, then comes, so what are the main signs and symptoms? Remember, any disease that we study, we have like 4 main headings, right? What are the signs? What are the symptoms of disease? What are the signs of disease? And how would you diagnose and how would you treat? And the first heading is pathophysiology, or the cause, or what is the background, right? So all the diseases that you read, since you will write down in 4th year, tomorrow you will be in the 5th year, right? You have to understand what are the important things, and there's so many diseases to read about. But if you know these 5 headings, you can always remember all the cases. The 5 headings are like, what is pathophysiology? That means what is the definition, how it is caused, and where the problem lies. Then what are the symptoms of the disease, and what are the signs of disease, and then what is the diagnostic tool that you use for diagnosis and how to treat. 5 headings will always help you understanding any disease, regardless it's medicine, surgery, pediatric, whatever, right? So remember, remember, we talked about what is the Wilson disease, we talked about its pathophysiology, its causes, and now we talk about what are the signs and symptoms. So as we discussed, the main organs affected are liver and brain. So the main presentation will be concerning with the liver and the brain. Remember this one, right? So the 2 organs that we talked about. So what happens in liver disease? Now, Wilson disease comes in the youngerhood, right? It may come at early childhood to an adolescent, or like a early middlehood, like 20s, 30s, 40s, and this is where the disease comes in, right? So in this case, the younger age is like the kiddish year, the children years, the child years, or the adolescent are dominant with the liver manifestations, and the adult form, which is like beyond adolescent, comes with the immunological form. So remember, so that it affects 2 disease parts, liver and brain, and the liver disease is from the earlier age, and the brain part comes in the later age. So remember, it's very simple to remember. Okay? Now they basically the children and teenagers will come with these complaints, and these are related to liver. So of course, liver per se does not have a complaint. It causes secondary complications, secondary problems, like it may come with extreme tiredness because liver is not functioning properly. And it may come with vomiting, there's weakness, they may come with abdominal distension, right? They may come with swelling legs, or they may have yellow skin like jaundice, or they may have itchiness because of jaundice, right? And they may have increasing breathing tendency and confusion. So all these functions are basically liver functions. You know what does liver do? Liver has to do with detoxification. So when it does not detoxify, it will cause problems, right? It has to do with the protein synthesis, right? When the protein synthesis is gone, what will happen? There will be accumulation of fluid. We call it third spacing, right? So you'll have fluid in the abdomen, in the legs, so hence there will be abdominal distension, or may have swelling of the legs. We have jaundice because it is causing the damage to the red blood cells, right? And if the liver is damaged because of chronic liver damage, it will lead to hepatic cirrhosis, and that may lead to confusion. So vegetative signs you mostly generalize weakness, tiredness, jaundice, vomiting, weak abdominal extension, because they are related to the liver. And what else can you find out? And they may come with the usually varices, come with the vomiting of the blood, right? They may have on examination, they may have spleen of the belly, and they may have ascites. So in younger children or in teenagers, if you find somebody coming with a liver disease, right? Somebody like a 10-year-old or a 12-year-old or a 15-year-old comes with a liver disease, and you have signs of chronic liver disease or liver failure, you might think of Wilson's disease. The other thing it also causes is hemolytic anemia, right? Because it also has RBCs, so it may have anemia, right? And because of your involvement during portal hypertension and because varices and splenomegaly. So splenomegaly and varices is caused mostly because of portal hypertension. And that comes when the liver is affected chronically. So when the liver is going into chronic liver disease, CLD, then it causes all these features, right? Initial signs of non-specific symptoms are like tiredness, vomiting, weakness, right? And when you have failure of the liver, that is liver going cirrhosis, then you have all the cirrhotic features. And these cirrhotic features, same as you see in adults, right? If you have liver failure features in young people, think about Wilson's disease, right? Remember. Okay, let's go. And like we talked about, what else can you see? Well, you can see spider angiomas, like red spots you see on the chest, on the hands, and you can see and in the chest. And these are signs of chronic liver disease. Rarely, as we talked about, the Wilson's disease can cause chronic liver disease. It may also cause acute or active hepatitis, right? Because at times it may come acute fulminant hepatic failure. So remember that Wilson's disease liver may have chronic features, may have acute features, and they may have 5% may have fulminant hepatic failure. It may lead to death in a short time, right? And they may have also hemolytic anemia. So remember, if you have an anemic picture on the blood and hepatic failure, the combination would lead to the possibility of Wilson's disease. And as we know that patients who have chronic liver disease, they may build up hepatic cellular carcinoma. However, this problem is rare we see in patients with the Wilson's disease. So they may have chronic liver disease, but they do not have hepatic cellular carcinoma. Right? So let's a brief recap: liver and brain affected. And liver there is a young age that is affected. It is the childhood or the young adulthood, and they may come with signs of liver disease. They may have acute liver disease, and they may have fulminant hepatic failure in a very small percentage, it is less than 5%, and they mainly come with chronic liver disease, like signs of the CLD, which is ascites, swelling in the body, tiredness, jaundice, right, itching of the body, and it may be seen in a combination of hemolytic anemia. So this is the presentation in the younger world. Now let's talk about the brain. Now, as we talked about, the brain-related symptoms come in the bit older age. We have 20s or older age. So somebody may come in 40s, may come in 30s, may come in early 20s, 21, 22, and there this you think about the possibility of Wilson's disease. And these patients, when we talk about the brain, there are two types of manifestations: neurological and psychiatric. So 50% will have psychiatric presentation and 50% will have neurological symptoms. So in young people, somebody when it comes to psychiatric and manifestations, very often we don't think of Wilson's disease. We think about general anxiety disorders, depression, and all that. But as you can see, that it may be because of the Wilson's disease, right? Okay. So let's talk about the psychiatric symptoms. The psychiatric symptoms are normally they have a mild cognitive deterioration. So they may have performance deterioration in their offices, in the school, in the colleges. They become clumsy. They have a change in behavior. Again, we have anxiety, psychosis, depression. So they may have simply the general anxiety, psychotic features. They may behave abnormally, have more aggression, more fighting, or they may have change in behavior. They were pretty extroverted, they become introverted, they're not talking, they have a change in behavior, change in mood, and then they have also cognitive deterioration. So the performance is not as what it was. So 50% have only psychiatric manifestations, and when you investigate them, you will find that they have Wilson's disease, right? Then you have neurological symptoms. Now, neurological symptoms has a wide spectrum of manifestations. The classical presentation is Parkinsonism. So if you have Parkinsonism features, which you remember we talked about, or perhaps we'll be talking about in our next lecture, there are four main cardinal features, which will include the rigidity, the slowness, bradykinesia, and bradykinesia means slow movement. So somebody is not as fast as he was. For example, he could eat his dinner or lunch in let's say 15 minutes. Now he will be taking about like 30 minutes. His walk, his gait is slow. He takes longer time in doing different tasks of life. So the life gets slower. He's slow. That means he's bradykinetic, right? And he may be rigid, right? And then he may have the falling tendency to fall, and may have tremors. Tremors. So tremors can be different types. Tremors may be present, may not be present, right? And they have the classical Parkinson's feature, which includes facial expression, third speech, and they may have ataxia or coordination. Ataxia and lack of coordination is not a feature of Parkinsonism. It is a separate feature, right? It is mainly Parkinson's features are called trap. If you want to remember Parkinsonism, and there's a four-letter word that will help you in identifying called trap. And T stands for tremors, R for rigidity, and P stands for the B stands for the A stands for akinesia or bradykinesia, that means slowness, and P stands for postural instability. It's called TRAP. TRAP. It's a small mnemonic which helps you in identifying the Parkinson's features. If you find normally Parkinson's is seen in elderly years, like 50s and 60s and 70s, it is not seen in early years. So if you have a young man or a young gentleman coming to you with Parkinson's features in his early 20s, please don't forget to check for Wilson's disease, and this may be causing it out, right? You must remember this thing. In neurological symptoms, the subset dominant picture is Parkinsonism, right? Then they may have ataxia, the cerebellar findings, which is written over here. So they may have ataxia. They are cerebellar, they are clumsy, they cannot walk, they have finger nose pointing, they have heel chin abnormality, they cannot walk tandem. These are all cerebellar signs. So they may have the signs of basal ganglia, they may have signs of ataxia of the cerebellum, because it depends upon where is the copper getting deposited. And the copper gets deposited in the basal ganglia, so it has the main manifestations of that of basal ganglia. They may have Parkinsonism or they may have dystonia. Again, this is also because of the basal ganglia involvement. And in the dystonia is a persistent chronic contraction. For example, the hand is like this, or you they turn like this. This is called dystonia. This is strong movement of muscles. This balance between flexors and extensors, or one group versus the other, and that the one group dominates, so it turns that part of body in its favor, and there is a persistent contraction, right? It may wax and wane, so may have tremors. It's called as dystonic tremors, right? So remember, it may have Parkinsonism, may have dystonic, and this is again because of the involvement of the basal ganglia. If there is involvement of cerebellum, it may show cerebellar signs. Other features are they may have seizures and they may have migraines. Well, migraines because of maybe there is more frequency of migraine, but we cannot say why migraine is more common in them. But seizures possible again because of deposits of copper in the brain. And regarding the tremors, they may only come with tremors, which is again the feature of Wilson's disease. And these tremors are classically called the bat winging tremors. Where you ask the patient to extend his arms and hands like this, and ask him to do extend his arms and close his eyes, and he'll like bat. His arms will go like this, which is called bat winging tremors. So logically, remember, because of involvement of basal ganglia. So just to make things easier, let's say you think where it gets deposited, and because of that deposition, the patient will show those manifestations, like Parkinson's. Like it gets deposited in the brain, and where in the brain, then it gets affected in the basal ganglia. Basal ganglia has to do with the movement disorders, so it comes to movement disorder like Parkinsonism or dystonia. It may get deposited in the cerebellum, will cause cerebellar signs. May get involved in the brain, in the cerebellum, and may cause seizures, right? And tremors, well, tremors can be part of Parkinsonism and can come tremors alone, but tremors, when there's no specific point where you can say that the tremor is caused because of that in the brain. However, tremors are common manifestation of Wilson's disease. So remember, guys, there are 4 or 5 manifestations of the CNS, right? So we talked about, just a recap, in the youngerhood, the very small age, the liver disease. After 20s or the late teens, it comes with the neurological manifestations. And classically, Parkinsonism or Parkinsonian features, or dystonia, or tremors, or you can seizures and migraines. Now, there are other organs that are also affected by the copper deposition, and these are different organs and they have different manifestations, right? So now come to the other organs. Okay, so first is eye. And eye is very classically involved in Wilson's disease. It does not affect the vision, basically, right? It does not affect your vision, so you do not come with blindness or vision, but you have a ring deposited in the cornea, which is very much orthogonal and a very classical sign of Wilson's disease. When the term orthogonal is used, it means that this is a very classical sign. So if you find this, then you're definitely sure that this is this is the same disease. So this is called as Kessler ring. Remember, guys, if you suspect somebody of having Wilson's disease, please send a patient to the eye department or for the ophthalmologist to check for Kessler ring. Okay. This is basically seen in the cornea, it's seen in the margin of the cornea, and it can be seen by the torch or by slit lamp irradiation. So the better, because you might miss it out, so slit lamp irradiation is the better, because slit lamp gives you an idea of the whole depth of the cornea, right? So that exactly helps you to where in the cornea is like. And why does it happen? Because it happens because of deposition of descendant membrane of the copper in the descendant membrane, and the rings may have different colors: dark brown, golden, reddish green, and they're about 1 to 2 millimeter wide and appear as a corneal limbus. Okay. Well, some people all Wilson patients may not have Wilson, may have Kessler ring. So don't think that if it is not there, it is not a Wilson disease. Well, most of them have it, but they may not have it, right? And in addition to that, so the deposition will also get in the lens, leading to cataract formation. The cataract is classical sunflower cataract, right? And remember that it is about 66% of patients. Here is a picture of you can see of Kessler ring. See the brownish, light brownish ring seen at the limbus of the cornea. This is because of deposition of copper in the descendant membrane. It is seen in about 66% of patients with Wilson disease, may not be seen in all patients, and this is orthogonal of Wilson disease. So, gentlemen, ladies, remember, this is the Kessler ring that you must see. It can be seen also with the direct eye or torch, and may seem better by the slit lamp examination, right? Okay. So the other thing is it might affect the kidneys and then lead to renal tubular acidosis, right? Because it affects the tubules, because of the copper, and because of renal acidosis, it will lead to nephrocalcinosis, which means accumulation of calcium in the kidney, or may lead to weakness of the bones because it causes loss of calcium and phosphate in the bones, and occasionally may lead to amino acid urea, which is essential amino acids, will needed for because which is the essential amino acids lost in the kidney, which leads to loss of the amino acids. So mainly in the kidney, it affects the renal tubules. Because of that, it may cause hypercalcinosis, increased calcium deposit in the kidney, and it weaken and more loss from the bones, is making bones weaker and depositing calcium in the abdomen, the kidney, leading to nephrocalcinosis, right? So remember, they call renal tubular acidosis type 2. Right? It may also affect your heart, and in heart may cause cardiomyopathy because of the muscle or weakness of the heart. And however, this is a rare, but it is a rare recognized combination of Wilson's disease. And that may lead to pump failure, seizures like congestive cardiac failure, may come with shortness of breath, and may come with fetal edema, right? And may also lead to cardiac arrhythmias, which is like slow or fast heartbeat. So, and then it will affect hormones like parathyroid hormone and leading to low calcium. So it affects the kidneys, leading to more calcium excretion, and affects parathyroid hormone. So the production or the calcium deposition becomes less. So it causes less production of calcium and more loss of calcium, leading to hypocalcemia, right? And also that it causes infertility and causes recurrent miscarriages. So again, the revision, the 5 to 4 organs which are mostly affected. Now, mainly the liver in the younger childhood, then the brain in the older phase of the life, like from teenagers to from 20s to above, and the neurological manifestations are psychiatric or neurological. And apart from brain, it may affect your eyes. Again, an eye scan that may affect the cornea and may affect the lens to cause cataract, right? And it may affect your heart, which is again rare, but it does affect heart. It may cause features of cardiomyopathy, like congestive cardiac failure, or may cause arrhythmias, right? And it may affect your hormones, leading to hormonal parathyroid hormone, leading to more calcium loss and leading to features of um, low calcium, like osteoporosis or bone fractures because of low calcium. It may cause infertility and recurrent miscarriages. So remember that these are the main features that you need to remember. Don't forget case of sexual ring because it's very important and orthogonal feature of your Wilson's disease. Now, how do you make a diagnosis? And the instrument diagnosis is made by mainly if you have the logical manifestations, MRI brain is the main part of the diagnosis. And remember that the gold standard test for diagnosis is liver biopsy. So the test that will help you in diagnosis and tests which are like gold standard tests. Tests which will help you in identification include MRI the brain, right? And what do you want to see in MRI brain? In MRI in the brain, you would like to see the deposition of copper and where in the, of course, the basal ganglia. And this can be seen in T2 setting. What do you mean by T2 setting? Well, in MRI, you have different sequences. So they throw magnetic rays on the patient and get the images, right? Now, when they throw it in different manner, images show a different picture, right? For example, those images have different names like T1, T2, DWI, flare, right? So they have different names of the sequences. So then you know okay, what sequence apply. So T1 is basically used for the abnormal anatomy. If you have something anatomically wrong in the patient, you will see in the T1. And the T2 is seen with abnormalities of the brain. So there is a change in the signal on the MRI, and the signal the pathology appears to be hyper intense, which means white. If you look at an MRI, MRIs are black and white. So a CT scan, right? So when you have pathology in the brain, it will appear bright. It's called as hyperintense. It looks like white color on this scanning. So this is called as T2 weighting images, and you can see the changes accumulation of copper in the basal ganglia on T2 weighted images, right? And then when it gets accumulated, it classically causes a picture called face of giant panda. Giant as you see, panda has black and white picture, his eyes and ears. The classical member that is called as face of panda, right? So that's what we call MRI. So that's why if you do an MRI and you find depositions, signals in the basal ganglia or a picture resembling face of panda, that means that this is probably Wilson's disease, right? Now you may do an MRI and then you may have blood tests. So blood tests are very helpful because copper metabolism is affected. So if you do copper levels, if you do cerebrospinal levels right, and if you do the 24-hour copper, you need copper. So it's a combination. You can't if one is present only the other and the two are not present. You cannot label a disease. However, it is a combination of two. You need to look at the serum copper levels and you need to level ceruloplasmin. So what is ceruloplasmin? Ceruloplasmin is a protein that carries your copper, right? So if you have low level ceruloplasmin, that means there's a problem, there's a gene problem. The gene is not producing the protein that is required, and that's what is causing you Wilson's disease. Okay, so you may have low serum ceruloplasmin levels, you may have copper levels in the blood that are high, you may have increased level of copper excreted in the urine. So remember, there is the blood test that will help you include serum copper level, serum ceruloplasmin level, and the urinary copper level. So these will help you in identifying this is something going wrong with your copper metabolism. The gold standard test that you like to confirm if you want to know there is a liver biopsy because you can see the copper deposit being deposited in the liver. So that's why you can make up a diagnosis. As well as the gold standard test is liver biopsy. Now, so you made it. So now you talked about the pathophysiology. You talked about the signs and symptoms, right? You talked about the diagnostic tools. Diagnostic tools may your blood test and brain imaging. Now, once you've made a diagnosis, how would you treat the patient? So the first one is diet. You need to cut off dietary copper, so there is not much copper to bind in the gut. So there's no much not much intake from within the gut. So to keep the levels settled out, so you need to reduce that foods that contain copper, right? So you need to avoid foods that contain more copper, including mushrooms, nuts, chocolate, dried fruit. So you all are liver, sesame seeds, pecan sesame oil, and shellfish. So these are the different examples of your things which are rich in your copper, right? Mushrooms, nuts, chocolate, dried fruit, liver, sesame seeds, and sesame oil and sugar. Now, how would you treat? So you know that the problem is with the accumulation of copper, and you want to take so any drug that removes the copper from the body will help us in removing the excess of copper in the wrong places. So that's how you can get the patient become better, right? So the drugs which cause were called chelating agents, right? And the most common used is penicillin. It's a very strong chelating agent. It helps removing the penicillin, right? But this penicillin is not a very good drug because not a good drug because it causes other problems as well. So the very notorious problem is SLE. Penicillin causes drug-induced SLE. Remember, it's a very common find, a very classical finding that you need to know. Although it is a rare, it's in less than in about 20% of patients, but penicillin and SLE go hand in hand, right? And when you start the treatment, as the drug chelates the copper, initially there is worsening of symptoms, and those who are intolerant to penicillin will try another drug called trientine hydrochloride. There's another form of chelating agent, right? So you have penicillin, right, and you have trientine hydrochloride. So once you have detoxification, so once you have removed all the calcium in body deposits, you need something to maintain, and that is called, so then you can give zinc, right? And it forms an acetate salt with your copper, right? Right. Once the copper level is touched normal, you'll be using zinc, right? In order to maintain so that there is less absorption. And how does zinc work? It basically works by stimulating a protein called metallothionein, which is in the gut, and this combines the copper and prevents their absorption. So zinc helps in reducing the absorption. There's no more copper being absorbed to get deposited, right? And